How does a neurological examination diagnose MS? Imagine trying to solve a puzzle where some pieces are missing or out of place. That's similar to how doctors look for clues to diagnose multiple sclerosis. A neurological examination is a key step in this process. It helps doctors see how well your brain and nerves are working and whether there might be damage in your central nervous system. This exam looks at different functions like muscle strength, coordination, reflexes, sensation, balance, vision, and even thinking skills. If there are abnormalities in any of these areas, it could suggest nerve damage that fits with multiple sclerosis. The process starts with the doctor asking about your medical history. They want to know what symptoms you've had, when they started, and if they've gotten better or worse over time. This helps them understand how your symptoms are progressing, which is important because multiple sclerosis symptoms often come and go or change gradually. During the exam, the doctor might ask you to push against their hand to test your muscle strength. They will check your muscle tone to see if it's too stiff or too weak. They might ask you to do tasks that test your coordination and balance, like walking in a straight line or touching your nose with your finger. Reflex tests are common too. The doctor taps specific areas like your knees, ankles, or elbows with a small hammer to see how your nerves respond. Abnormal reflexes, whether too strong or too weak, can be signs of nerve damage. They will also examine how you feel touch, pain, or vibrations. Your eye movements are checked to see if your cranial nerves are working properly, which can be affected in multiple sclerosis. The doctor may ask questions to assess your thinking skills, such as repeating words or answering questions about the date or your location. These tests help pinpoint which parts of your brain or spinal cord might be affected. If the exam finds signs like weakness, abnormal reflexes, coordination issues, or changes in thinking, the doctor will usually order more tests. Magnetic resonance imaging scans can show areas of inflammation or damage called lesions. Sometimes, a lumbar puncture is done to analyze cerebrospinal fluid for signs of inflammation. In short, a neurological exam is a vital first step in diagnosing multiple sclerosis. It provides direct clues about nerve function and helps guide further testing. The exam is thorough and can take about an hour, focusing on the many ways MS can affect the nervous system. Remember, everyone's experience with MS is different, so your healthcare provider will tailor the assessment to your specific situation. Always consult a medical professional for personalized advice and diagnosis.